Welcome to today's episode of Mindful Medicine. I'm your host, Tracie Jones, and I'm here with Dr. Jim Schrenker. Today, we want to talk about thyroid treatment. Dr. Schrenker, could you tell us about thyroid treatment for your patients?
Yeah, so the key with thyroid treatment is balancing your T3 and your T4. The T4 to T3 ratio is actually what drives your well-being. It drives how well you feel. The ratio is somewhere between 12 and 15, so like 13 and a half to 1, T4 to T3. T4, when I'm talking about that's levothyroxine, Levoxyl, Synthroid. T3 is liothyronine or Cytomel. The compilations that we use, though, are NP Thyroid and Armor. NP Thyroid and Armor have both T4 and T3 in it. Those are superior drugs to just a T4 drug, so superior to Synthroid or levothyroxine. But it's not adequate on its own to treat hypothyroidism in the vast majority of patients. So if I was going to estimate, I would say 80% of our patients are on both Armor or NP and levothyroxine. 10% are on just levothyroxine and 10% are probably just on a desiccated thyroid. But trying to get that ratio, you can't get the right ratio with just NP or Armor. You have to add a little bit of T4. So the majority of our patients, if we're going to start somebody out, it's usually going to be 30 milligrams of NP thyroid and 50 micrograms of T4 or Synthroid. From there, you have to let the medication work for 3 months. It takes 3 months for the hypothalamus and the pituitary to get on board and the thyroid to get balanced. You can't do it in 6 weeks. You can't do it in a week. You got to wait 3 months. From there, we'll check a full thyroid panel, and we're literally just trying to get the T3, free T3, T4 up to the top of the bell-shaped curve. So with T4, we're trying to get to 8.2. With T3, we're trying to get to 125. And with free T3, we're trying to get to 3.2. Now notice we haven't talked much about free T4. Free T4 is kind of the stepchild. That test in particular is very limited by biotin and some other B vitamins that you take. It's notoriously low in a lot of people, and it really has no therapeutic benefit. We check a T4, but we don't rely a whole lot on trying to get that to an optimal level, which would be about 1.3. If there's two tests I want a T4 and a free T3. But the total T3 is very important for us as well if we're going to draw it.
So you're discussing two different types of thyroid medication. So is this going to be covered by insurance? Because it sounds like an insurance company might say, I'm not going to pay for two medications for thyroid.
Right. Well, your first hurdle is to get the pharmacist to prescribe it. Because if the pharmacist is not aware of thyroid balance, they're going to tell you that these medicines are doing the same thing. They're duplicate therapy. You don't need both. In our community, we've been doing it long enough that every pharmacist understands what we do. And in fact, a lot of them are our patients here now because of it. So we don't get a lot of pushback from the pharmacy level. From the insurance carrier level, Medicare will not cover NP thyroid, Armor thyroid, or even liothyronine, the synthetic form of T3. There is a list of medicines that are potentially dangerous to people that are 65 years of age or older, and that is on that medicine. That is on that list. That list is archaic. It's nice to know, but it shouldn't really be followed from the insurance carrier standpoint, but they do. They'll use anything they can not to cover it. So your NP and your Armor are not going to be covered under your insurance. GoodRx, Mark Cuban Drugs, things like that is where you want to go to. But you're looking, it's not cheap anymore, but you're looking anywhere between, $40 and $60 for a 3-month supply of that medicine.
Okay. Which sometimes is what your insurance would require you to pay anyway,
right.
Correct?
Yeah. It's not that much, but if you don't have the money, it's a lot of money.
Right.
So But yeah, so when they come in with us, we're going to do the full thyroid panel. We're going to usually put them on a combination of an NP or an Armor and a T4 product such as levothyroxine. I think Armor is slightly superior to NP, but the price has gone up so much with Armor that it's hard to support that. And if we really want to get into the weeds, there's really two types of NP. There's an NP thyroid that is purely synthetic. It's a levothyroxine liothyronine combination, so a synthroid cytomel combination. And then there's an NP thyroid that is desiccated pork thyroid, which is what Armor is. Armor got a bad rap when it first came out. One of the first, if not the first, thyroid preparations ever made. But it was desiccated pig thyroid, and it was not stable unless refrigerated. So it had to be refrigerated from the time it was made till the time it was consumed. It had to be kept in the refrigerator. And the pharmacists didn't put it in the refrigerator, and patients didn't put it in the refrigerator, so it didn't really work. So it got a really bad rap, and that's kind of been perpetuated throughout years of teaching in medicine. The lyophilization process that they have now is much more stable. It does not have to be refrigerated, and it works much better. There's just no reason not to be on both. It's not harmful if you follow the full thyroid panel. But I'm telling you, they're not going to be able to talk their doctor into it. It's like talking to a brick wall sometimes. And I've talked to endocrinologists in the area, and they just don't buy it. They don't believe it, and that's why we have all their patients. So
how did you come about learning this and understanding that you needed both?
Well, the same way that I learned about most of holistic medicine. I was paying attention to what my patients talked about, and they would come in and they'd have normal TSHs, and they said they feel lousy. And then I came across an article, and I can't remember who wrote it. It's a PhD that actually did basic bench work in thyroid. And this is 20, 30 years old, this study. And he talks about finding the optimal ratio between T4 and T3. And it just made a bunch of sense. I'm a molecular biochemist. So once I understood that, I was using liothyronine and I was using synthroid, and then I came across NP and Armor. And then over years and years and years, you realize that NP and Armor have a longer half-life. So you can take one pill a day and it lasts all day long. Liothyronine, cytomel, its half-life is 4 to 6 hours. You have to take cytomel twice a day if it's going to work, because the morning dose is going to be out of your brain by noon. So you have that you have to do twice a day, then you have to do the levothyroxine. It's just a pain. But if we do the NP and we do the Armor, it works beautifully in most people.
So I've heard stories out there, and I don't know what the case is, but is it really important when you take those medicines? Like I've known some people that say, before I even get out of bed, I take this one first on an empty stomach, and then I wait 30 minutes and take the other one, and then I wait 30 minutes before I take anything else. Right. So is that the case? And if so, why is that so important?
It is in some people. Thyroid preparations are very, very sensitive to the pH of the stomach. When you add food to a stomach, your pH goes up. Down is acidic, up is alkaline. When you add food to the stomach, it becomes more alkaline because it's digesting it. It's mixing the acid in the food is diluting each other. So thyroid preparations require high acid content to digest. If you're on Protonix or you're on Prevacid or you're on any one of those acid suppressing medications, it doesn't really matter when you take it because you don't have any stomach acid. So if you're getting bad results and you're on a stomach pill, take it with vitamin C. Take it with a little bit of apple cider vinegar. So if you take those preparations on an empty stomach, the acid content of the stomach is at its maximum and you will absorb it better. Now, does that really matter? Not in everybody. If you're not on an acid acid suppressing medication, you wake up, you can take your medication, just make sure that you're eating the same stuff almost every morning or drinking the same coffee every morning. So it doesn't have to be an empty stomach. You could wake up, take it, drink your coffee, wait 15, 20 minutes and eat breakfast. That would be fine. Because if you're doing the same thing every day and we check the blood work, we'll know whether you're absorbing it or not, right? So yes, it does matter, but no, not to the extent of a lot of people, which wake up in the middle of the night and take it in the middle of having an empty stomach. I don't know that you necessarily need to do that.
Okay. All right. Well, thank you. So how would you wrap all of this up in your office?
I would wrap it up by saying that the thyroid is literally one of the most important things to get balanced. You're not going to get anything better in your body until your hormones are balanced. Sex hormones, thyroid hormones, all your hormones. And vitamin D is a hormone. So you got to get all that balanced before you move on to any type of healing program. So the thyroid is essential. So we reiterate diet. If they have autoimmune thyroiditis, let's try to avoid gluten. Does gluten matter to you? If it does, then you need to avoid it. If it doesn't seem to matter to your thyroid disease, then you can have it. Where are you at metaphysically? What are you doing with your life? Where are you at in your life? Are you following your truth? And then supplement-wise, what's their B12? What's their folic acid? What's their D? What's their magnesium levels? We go in to make sure that those are okay. And then last but not least, is the medication regimen working? So if you're stable on your thyroid, you just need it checked once a year. You may not even need it checked once a year because you're going to know if you don't feel well. But we check it once a year most of the time here anyway. We like to see those numbers at the top of the bell-shaped curve that we showed you earlier. And if we can get those numbers there, then we can move on. It doesn't mean you feel better, right? There's a lot to your body. But if we can get those numbers at the top of the bell-shaped curve, then we can simply say it's not your thyroid that's causing your fatigue. It's not your thyroid that's causing weight issues. So that's kind of where we want to go, again, in the stepwise approach to the human being, in the holistic approach. What can we eliminate as a problem for why they don't feel well? And sometimes it takes months to figure that out, but we're pretty good at it, and we do a pretty good job of it most of the time.
Great. Well, thank you so much, Dr. Schrenker. I appreciate your time today. And thank you for watching this episode of Mindful Medicine. Remember, you are loved.